The topic I will be discussing is the importance of new graduate registered nurses providing a culturally safe environment for Aboriginal and Torres Strait Islander people within the hospital. New graduate registered nurses need to be culturally safe when working alongside Aboriginal and Torres Strait Islander peoples and when delivering nursing care to Aboriginal and Torres Strait Islander patients. In this presentation, I will provide you with a background of the importance of cultural safety for Aboriginal and Torres Strait Islander peoples. I will explain why cultural safety for Indigenous Australian peoples within the hospital environment is a significant issue to contemporary nursing practice for both patient safety and a healthy workplace. I will also state what is being done today about creating culturally safe environments in the hospital for Aboriginal and Torres Strait Islander peoples. And more importantly, I will explain how effective leadership may contribute to resolving or migrating the problem and lead to a culturally safe environment for Aboriginal and Torres Strait Islander peoples within the hospital. Finally, I will explore responsibilities of a new graduate registered nurse in relation to the concept of cultural safety, including nurses' scope of practice and legal and ethical boundaries. To understand the contemporary issues that Aboriginal and Torres Strait Islander peoples are faced with today, it is important to have an understanding of Australia's history of colonisation and the treatment of Indigenous Australian peoples within Australia's past. In Australia's history, the colonisation of the British in 1788 led to an imbalance of power and the dispossession of Aboriginal people from their land. The policies of segregation and assimilation led to the forced separation of Aboriginal children from their families, where Aboriginal children were placed in missions where they were taught to adapt to a new way of living similar to the British. This separation of Aboriginal people from their families caused a dispossession of Indigenous communities and resulted in a loss of Indigenous Australian culture. The mistreatment of Aboriginal peoples in Australia's history resulted in Indigenous Australian people being subject to institutional racism and racial discrimination. I have included a link to a video that is helpful for auditory learners to learn about the importance of cultural safety today. In our contemporary society, the history of colonisation of the British and the mistreatment Indigenous Australian people experienced continues to have an ongoing impact upon Indigenous Australian people. In the healthcare system today, there has been an ongoing need for a healthcare environment that is culturally safe and inclusive of Aboriginal and Torres Strait Islander people's culture. Cultural safety can be defined as an environment which is safe for people, where there is no assault, challenge, or denial of their identity, of who they are and what they need. It is about shared respect, shared meaning, shared knowledge, and experience of learning together with dignity and truly listening. Cultural safety is about individuals respecting the cultural identities of others. New graduate registered nurses are required to have the appropriate knowledge and skills to provide culturally safe nursing care to patients. I have highlighted the important words in the definition of cultural safety. This will help visual learners to learn about the meaning of cultural safety and the skills required to be a culturally safe new graduate nurse. Indigenous Australian people have the right to feel safe when accessing healthcare services. However, Indigenous Australian people have had experiences of neglect and discrimination whilst accessing healthcare and have received care that is not culturally appropriate. Aboriginal and Torres Strait Islanders are more likely to discharge themselves against medical advice for a variety of factors. Many have a distrust of hospitals and they might encounter poor communication, institutionalized racism, and cultural insensitivity. If nurses do not provide care that is culturally safe and that is not respectful of Aboriginal and Torres Strait Islander peoples, this will lead to a healthcare environment that is spiritually, socially, and emotionally unsafe for Aboriginal and Torres Strait Islander peoples. Providing culturally safe care will improve Indigenous Australian people's engagement in healthcare services and will result in improved health outcomes for Indigenous Australian people. Additionally, there is an ongoing need for a healthier workplace environment that is culturally safe and equally inclusive of Indigenous Australian staff. Indigenous Australian people have the right to a culturally safe workplace where they are respected and not discriminated against for being Indigenous Australian person. If the workplace does not reflect a culturally safe working environment, this could lead to racial discrimination and bullying towards Indigenous Australian people and impact negatively on Indigenous Australian people's emotional well-being and mental health. Indigenous Australian people that are racially discriminated against will experience higher levels of psychological distress and are at higher risk of depression and anxiety. In our contemporary society, nursing is a profession that requires nurses to be able to work with staff and patients from diverse cultural backgrounds. Within contemporary nursing practice, there is an increased importance in nurses being culturally safe and being able to provide respectful care to Aboriginal and Torres Strait Islander people. Nurses need to ensure that their nursing practice reflects Indigenous Australian people's culture to ensure that they are providing culturally safe nursing care to Indigenous Australian people's contemporary needs. Additionally, nurses need to shape a workforce that allows staff to be culturally safe. This includes Aboriginal and Torres Strait Islander colleagues being valued and respected members of the nursing team. In order for the workplace to be a culturally safe environment for Aboriginal and Torres Strait Islander people, many health districts provide cultural safety training for their staff, including the Aboriginal Culture Respecting the Difference course. The Nursing and Midwifery Board of Australia have introduced the principle of culturally safe and respectful nursing practice in the Code of Conduct for Nurses. The introduction of this code provides nurses with the knowledge on how they can work in partnership with Aboriginal and Torres Strait Islander people and work towards delivering culturally safe nursing care to patients. The Australian Commission on Safety and Quality in Healthcare has developed a cultural safety framework called the User Guide for Aboriginal and Torres Strait Islander Health. This guide provides healthcare workers with the skills required to deliver culturally safe and high-quality care to Indigenous Australian people. New South Wales Health have developed policy directives aimed at improving health service delivery for Aboriginal people. The development of these policies have supported culturally safe and secure health services for Indigenous Australian staff and patients. The policies set a framework on how to reverse the impact of racism in the healthcare system and how organisations can provide respectful and culturally safe care to Indigenous Australian peoples. To create a culturally safe environment for Aboriginal and Torres Strait Islander peoples within the hospital, nurses need to display effective leadership that is aimed at optimising patient safety and contributing to a healthy workplace for Aboriginal and Torres Strait Islander people. Effective nurse leaders use their professional and clinical knowledge to inform others of how nursing care should be carried out to achieve the best health outcomes for patients. Nursing leaders lead by example and use their knowledge to communicate information to others. Nurse leaders can create a culturally safe environment by educating other staff on how, as a workforce, they can create a safe environment for Indigenous Australian people. Effective leadership involves registered nurses using their knowledge of cultural safety to make suggestions for workplace changes, including changes to the workplace culture to make it more inclusive and respectful of Aboriginal people. Additionally, nursing leaders need to ensure that the nursing unit has the workforce and resources required to create a healthy and culturally safe environment for Aboriginal staff and patients. It is important that nurse leaders ensure that the hospital is an environment that is culturally safe for Indigenous Australian people in accessing healthcare. Indigenous Australian patients have the right to receive healthcare that is respectful and inclusive of their culture. Effective leadership involves nurses advocating for Indigenous Australian people's rights. This involves the need for nurses to incorporate culturally safe practices that respect Indigenous Australian people and ensures that they receive appropriate and culturally safe healthcare. I have included an image that lists the qualities that will support new graduate nurses in being able to be culturally safe to Indigenous Australian staff and to deliver culturally safe nursing care to Indigenous Australian patients. The scope of practice of a new graduate nurse involves new graduate nurses planning, assessing, and implementing care by collaborating with patients and providing culturally respectful care. New graduate nurses are required to recognise the impact that culture has on a patient's response to health and their illness, and modify nursing care to provide culturally safe and appropriate care to patients. As a new graduate nurse, my responsibilities in being a culturally safe practitioner involve contributing to a culturally safe environment by respecting and acknowledging Indigenous Australian people's culture, beliefs, and behavioural factors influencing health. New graduate nurses are responsible for being open-minded and respectful in their attitudes towards people from other cultures other than their own. New graduate nurses are required to be guided by ethical nursing frameworks, and this includes accepting individuals and groups regardless of their culture. Nurses are guided by the Code of Ethics. This identifies the need for nurses to respect the human rights of individuals. The Code of Ethics supports the content in this presentation as it identifies the need for nurses to respect the cultural rights of individuals and the right of dignity and to be treated fairly and with respect. As a new graduate nurse, I am responsible for contributing to a healthy work environment that is culturally safe by supporting the rights and dignity of Indigenous Australian colleagues. The legal requirements of nurses require nurses to engage in lawful behaviour, including practising as honest and ethical practitioners. New graduate nurses have obligations to work under New South Wales Health and safety laws, and this includes respecting diversity in the workplace and creating a safe and healthy workplace for Indigenous Australian workers.